Today, we're going to hear from Nathan West and also Travis Webster. As Travis mentioned, he's the co-founder of Seminarians-Healthy Church, which equips seminarians, clergy, and church leaders to explore practical ways of living into greater health and wholeness through education, research, and advocacy. And we're also going to hear from Nathan West. He is a research assistant professor of behavioral sciences at the University of Alaska. Uh, Nathan is a community engaged researcher who focuses on health promotion and chronic disease prevention. He primarily is interested in faith-based health promotion and partnering with faith communities to better understand the health needs of churches as well as their faith leaders. Today, they're going to be presenting the early results from their systematic literature review of clergy mental health. And so to get things started, I'll just say welcome. We look forward to your presentation. I'll turn things over to you all.
All right. Sweet. Well, thank you so much, Thad, for the introduction. And it's an honor to be here with everybody today to talk about this important topic. And so today we'll be talking, as we have already kind of discussed, clergy mental health. Question number one is, what do we know about it? And how can we effectively support clergy? So those are two questions I'm hoping we can all kind of keep in mind as we're walking through this presentation today. Next slide. I guess the next two slides. There you go. And just before I began, I thought it was important to talk about who this group is. And it's, Travis and I are the ones kind of leading this effort in terms of the data analysis on the paper we're going to be talking about. But this is a part of a bigger kind of scope. And so the people we're working with, and the group we're a part of, is called the Ministerial Wellness and Care Collective. And it's a group of multidisciplinary experts conducting rigorous research or attempting to conduct rigorous research intent on better understanding the health outcomes of faith leaders. And so I thought I just wanted to mention and talk about that this is not only the first study we've done together. We've presented some findings from a paper we did last year. Next slide. On mainly focusing on the physical health related outcomes among clergy, specifically the obesity related outcomes, and looking at self-care and how we define self-care. What does the literature say about self-care among clergy? We talk about these various factors that have been examined among faith leaders or clergy specifically, but what are all the studies together? What does it look like? What has been done? And so we talked about that last year. We had that published. And next slide. And some of the main things that we found where the literature actually defining self-care among faith leaders was pretty sparse. We had 20 studies overall eligible for that review that we examined. And we found that around 1 to 2, maybe one study specifically actually defined self-care in the context of clergy or faith leaders. And so we looked at, the reason I keep saying faith leaders as well is we looked across the religious spectrum. We didn't just look in the Christian context. And so it was really interesting kind of unpacking those data and unpacking those studies, because we did find, and our hunch was that looking at kind of the physical health related outcomes, obesity specifically, and self-care was mainly looking at physical activity, healthy eating, / diet outcomes, specifically vegetarian diet. And which was interesting, an unexpected finding was actually some studies were looking at vacation, sabbatical, taking time off. And that was really what has informed a lot of our work moving forward, is to start incorporating some of those other self-care behaviors in our research. And one of the other things that we found that was really interesting is that the studies that we examined actually, not many included behavior change theory, which is a roadmap of understanding of individuals' attitudes, behaviors, and beliefs. And so, and maybe given our research question, it would make sense that mental health was not a big discussion. But as we were finishing up our study, it was around the 2022 kind of post-COVID pandemic, we're recognizing mental health was becoming a big discussion point, and had been a big discussion point over the past few years while we were doing the study. And we recognized, hey, what does the literature actually say in the context of faith leaders or clergy in relation to mental health and self-care? Next slide. And so we started looking at that. But before I get there, I just think it's important to take a step back and say, we're not just doing the study just to do the study. Why is this important? Why are we looking at this? And I think it's really important to start with that clergy, specifically, are opinion leaders, are considered opinion leaders, are trusted gatekeepers, influential figures in the congregations and the communities they serve, ranging from politics to health to spiritual to mental health to physical health. And even anecdotally from my own dissertation, interviewing clergy on their perceptions of physical activity, just taking one behavior specifically, clergy perceive themselves as role models, role modeling these lifestyles. They viewed that as improving the way they serve and how they serve their congregations and communities. And so these are important things to consider as we're looking at clergy health and health behaviors. And one of the things that's interesting too, when you talk to clergy, is that many clergy report many vocational demands and barriers may be impacting their health, such as 24/7 on-the-go vocation, unmet congregational expectations, many factors impacting that. And I think something that's important to recognize too is this: yes, physical health is important, but clergy also report mental health outcomes as well. And if you look at, just for example, take the Barna State of Pastors reports in 2017 and 2025, they talked about a high prevalence of burnout and depression in both areas. And so these are two factors that, while we're looking at mental health, there's things still to consider, to examine. What are we missing and how can we continue to effectively support clergy? Next slide. And so the phase of our current work is we're in the very early stages, as we'll talk about in a minute, very early stages of kind of our next iteration of the work that we want to do. It's kind of a scope and review, seeing what's out there. It's before the systematic review piece. We're trying to identify what's the scope of work that's been done among clergy mental health, and how can we tie that to well-being and self-care, and what's the literature saying? What are things that we should be considering moving forward if we want to look at both physical and mental health? Next slide. And so, just to start off, some of our research questions. What literature is available that connects mental health and well-being among faith leaders? Question number one. Question number two, what aspects of caring for self or self-care behaviors are examined within the context of mental health? And then question three, what themes exist within the existing literature on mental health and well-being among faith leaders? So these are three questions that really informed, as I'll get to in a minute, our methodology and our questions. And as we talk as a group, what's our vision for this work? And what's the next steps after this work on how we can continue? I'll keep tying it back to what do we know about it and how can we effectively support clergy through this work? Next slide. And Travis, you want to take over this piece here?
Absolutely. So what we'd like to do is go ahead and take time for our second breakout time. And this is going to be our suggested discussion question for this time. What might well-being look like in the context of clergy mental health? So we talk about well-being, we talk about clergy mental health. What would that possibly be? What would that look like when you think about it maybe from a more practical standpoint? What might well-being look like in the context of clergy mental health? Look forward to seeing you in the breakout rooms.
Welcome back, everyone, and hope you enjoyed your conversations. I know that the one I was part of was incredibly interesting. I'm going to turn things back over to Travis and Nathan, and they'll present on the next part of their presentation.
Awesome. Hi, everyone. Hi again. So starting off this next section, I want to talk a little bit about, before we dive into some of the things we're finding in our early stage of our literature review, it's just how we're doing it. How are we doing this study, and what is it going to look like at the end? And so what the frameworks that we're using are some commonly used frameworks for scoping reviews. Mark O'Malley's frameworks. It's been updated since, and we're also using some Prisma extension for scoping reviews. Some guidelines to help it remain rigorous over time and rigorous as we do this. And so one of the part of this framework, and I just wanted to list out kind of how it works. So you first start off with, you identify the research question or questions, you identify the relevant studies, you select those studies, you then look at how we can chart, or at least kind of summarize the data, and then you report those results, and then you have a consultation. And so I would say in this phase, as we'll get to in a minute, we're still in the study selection / charting the data phase. So we are going through the literature very carefully to identify what are the common things that are being discussed related to mental health and self-care and well-being among faith leaders specifically. And one of the cool things about this is that having a group of multidisciplinary experts is that throughout we have this consultation. So it says it can be at the end, but it can be throughout as we find things. Hey, what do you think about this study? What do you think about this study? Should this still be included? And that helps us remain have accountability throughout the research. So I can, if I have a bias towards physical activity or certain things that should be included, we might have someone else that can come in and speak on different expertise. And so anyway, that's one of the cool parts about this research. And so through this, we've already kind of started identifying studies. We've used main databases. We've used backward reference searches through, looking at a study and looking at the references they use, and then gray literature reports, for example, like maybe the Barna Group State of Pastors reports. And the terms that we're using, as I mentioned, among faith leaders specifically, so we're looking across religious tradition, and we're looking at mental health, so common things like depression, anxiety, stress, suicide, and burnout, and then well-being. We talked as a group, how do we do this? Looking at knowing what we know about the clergy mental health literature or just mental health in general, how do we look at, other than physical health, right, where we looked at self-care specifically, how do you encompass all of the things that are being discussed in relation to mental health among clergy in general? And so we looked at flourishing and self-care and caring for self, and then specific self-care behaviors, like physical activity, vacation, Sabbath keeping. And so I just wanted to talk about kind of how the framework of what's guiding this study. So it's been a long process, but it's been really, really fun so far. Next slide. So this is just to give an overview of what we're doing. And so we had a grad student, and we had a couple people helping us kind of go through these studies, and a team of folks working through this. We start off with a lot of studies, and we had people sift through and see what should be included, what shouldn't be included. And we ended up with 49. And at this stage, we have 49. But as we go through, as I mentioned, through the consultation phase, we may identify, hey, this actually doesn't fit well as we go through the full rigorous review. So, but it just wanted to show you the process of how long it can take to go through some of these studies and really identify what can help us get to our specific research questions. Next slide. So, as I talked about charting those data, and what does that mean exactly? What type of data are we talking about? And I think one of the cool things about this approach are these studies is that you include almost everything, right? You have the author, you have the year it was published, you can see kind of how long and time frame of when research was started, kind of in mental health to where it is now. Study aim, study design, the measures, the well-being measures, and the primary findings. And one of the things that we found very fruitful in our other scoping review is using a thematic analysis framework that was 6 steps. So as I mentioned, one of the things like our other framework that's guiding our study selection, we're also trying to use a framework, or at least a model, to help us guide our analysis, which is a different step. And one of the cool things about this framework is that it allows some flexibility, but also rigor as you're working with other folks. And so, for example, the 6 steps are familiarizing yourself with the data. So reading through the research, generating initial codes, right? So, what theory did they use? What behavior did they measure? What thing of mental health, what factor of mental health did they look at? Then you start searching for themes. So across these studies, how can we summarize what's being examined? And then you review those themes and you define them specifically to come up with some common themes across the however many studies exist. And then you do a producing report. Then you produce kind of the final report of the research. And so right now, we are in between the generating initial codes and we're searching for themes. And so we'll talk about some of the initial things we're finding. So I just wanted to share the steps that goes into this and the rigor. But I think what we have, and as I'll get to in a minute, can spark some really interesting discussion and things for us to consider. Next slide. So just as an overview, So far, we're seeing mostly quantitative studies, are using surveys, cross-sectional at a pinpoint in time. They're looking at kind of a sample at one time stamp, and then not informed by theory. So studies are using theoretical frameworks. I think family stress theory was one of the ones, but health behavior theory, as I mentioned as the previous article, not many studies are using that as a roadmap, which is another interesting finding. I think, at least, how do we examine this rigorously, and what theoretical frameworks or models can we use or better look at to help us understand the mental health outcomes and things impacting mental health? And something else that's different than the physical health related scoping review that we had is most of these, or pretty much every population was either Christian clergy, so Protestant or Catholic, and then actively serving. We had some diversity in the physical health related one across religious tradition, which was really interesting to look at. But this is mostly a Protestant and Catholic clergy. Next slide. So this is something that I really have found interesting in trying to pinpoint this. And I've got something I'll show on the next slide. But as you can tell, I get excited about this because I think it's one of these things, where are we at in the literature? And again, going back to our first two original questions, what do we know about clergy mental health, and how can we effectively support clergy health? So it's not surprising that burnout and depression and anxiety symptoms and occupational distress and stress were also factors that were mostly examined. Those were in our search terms. It would make sense. But one of the things that's really interesting as we look at what is being examined in relation to mental health, I think, so if you look at box 2, explore the connection between social or ministry-related factors and mental health. So this could be occupational distress, social support demands, spiritual well-being was a big factor, which was different. Again, I'll keep tying it back to our original kind of physical health-related paper, because spiritual well-being wasn't really included in the physical health piece. So that's another factor that is really interesting, at least to consider moving forward. How does that play into, mental health? And what do we mean by spiritual well-being? Well, and some of the studies were looking at this idea of, the power and feeling the presence and power of God, right? And how does that impact mental health? Anything from ministry demands, resiliencies, congregational expectations, all related to mental health. And then you had some subset of studies that were actually looking at the kind of quote unquote self-care we were talking about. So you had, maybe the flourishing variables, or the physical activity and diet, or the vacation and Sabbath keeping and time off. And so I would say less than half of the studies were looking at that, but we're still kind of sifting through to see, what's being commonly examined. But I thought that was an interesting piece where the physical health related review was predominantly these variables kind of in self-care and physical activity, diet related factors. I would say probably in this review so far, vacation and Sabbath keeping, maybe time off, has been more prominent, which is interesting. And so anyway, I wanted to share this kind of an overview to get people thinking about just what do we know and what do you know? And maybe we could talk about that at the end. So next slide. And so one of the things, the way my brain works is my brain works in boxes and arrows and models and frameworks. And so I thought this is I'm glad I get to share this, because this is an unorganized way of my brain is right now, but at least it can help organize my thoughts and what we're seeing. So if you look at this conceptual model, mental health is at the center, but then you've got all these various factors at play right now in relation to mental health. And so spiritual well-being, job demands, personality dimensions, role identity and perceptions, congregational expectations, subjective well-being is also in there. You've got the training, so seminary training, resiliency, social support, family is also in there too. So I think I wanted to show this as aside as like, this is what we're seeing so far in the very early stages. And how do we take this and then say, okay, how do we, if you see the arrows pointing to mental health, and then you see the arrows pointing to each box, so spiritual well-being to job demands and personality dimensions. How do you then connect these in future research, right? To look at it from a more holistic lens. So you've got caring for self-care, right, as one piece that could be bidirectional, right? That could impact mental health, but mental health could also impact self-care. But how can you also look at these various factors together as a way to understand clergy mental health? And I know Travis has something to share too, and more of a practical side. So I'm trying to share in the more academic piece, but I know Travis has something to share from kind of the clergy health side too.
Absolutely. Thanks, Nate. One of he and I were talking about this and to present this, and Nate very much, as you know, an academic, currently working in the academic setting. I'm a clergy person working in a clergy setting, a parish setting specifically, and also with I'm a licensed marriage and family therapist, and did a lot of my early clinical hours working with seminarians who are preparing for parish work, and some clergy, and still work with some folks who are clergy who are serving in parish settings. And I really value.
Hey, Travis, can you try to adjust your microphone perhaps? You're coming in kind of muffled, but
Do not know if there's anything. I don't know. Can y'all hear me? Is there any?
I think that's better. Thank you.
Is that better? Okay. I just press buttons, hoping for the best, like all of us on Zoom these days. One piece of this research that's really important to me that I would like to be able to bring into working with clergy in a therapeutic setting, and also with Healthy Seminarians-Healthy Church, as we serve seminarians who are hopefully moving into parish work and whatnot, would be some good research based outcomes that we can point to, that we can say this really does make a difference. These are some practices and some ways to think about your well-being as a clergy person, and how you perform as a clergy person, and how you stay healthy and well as a clergy person, that would really make a difference for you. So Nate and I were talking about, there's modalities you can use as a therapist for certain particular concerns that folks have, cognitive behavioral therapy and dialectical behavioral therapy and things along those lines, that have ways of going through things in a more organized fashion. And I was telling Nate how lovely it would be to also have some really more specific research-oriented ideas that would allow us to work with clergy in the therapeutic setting or in the coaching setting or whatever the case might be, that we can say this really does, the research, as far as we can tell, it suggests that this really does make a big difference. So I'm hoping that practically that's a direction we're moving as well.
Yeah, thanks, Travis. Yeah, I just wanted to share this kind of overview. Again, it will, for later stages, it will be cleaned up as we kind of organize our thoughts and findings and have a more rigorous in-depth. But I think it's just really interesting to show the differences across the studies we've done. The first study was, I wouldn't say the word simple, but in terms of what we were looking at and related to physical health related outcomes, was much more direct. This has a lot of factors at play. And how do you compile all these and really design something holistically, looking at, yes, from a public health lens, and I'll share my bias is like, oh, I'm interested in physical activity promotion. But if I just look at that, I might be missing a whole other lens to look at clergy health from a spiritual self-care standpoint, right? Of scripture reading, of prayer, of, how do these things two interact to impact mental health? That's just an example as an aside. And so I wanted to share that, and I know we have one more small breakout room here, kind of looking at, kind of summarizing everything that we just talked about. So next slide. And before we get there, I wanted to share kind of the next steps for this work. So as I mentioned, even with this at the beginning stages, we've already identified the various factors at play. So the work that we have to do as a group is we're going to be doing a more in-depth, rigorous thematic analysis of what specifically about spiritual self-care impacts, for example, burnout, right? We still have these, even though there's been a lot of studies that have looked at this, the prevalence of burnout and maybe depression is still higher according to these Barna, take, for example, the Barna reports. So what are we going to do, right? So how can we look at specifically these variables and pinpoint certain things to then carry out in a future study? We want to chart those data and document those findings, then have a rigorous consultation with our group of multidisciplinary experts, and then want to submit the findings for peer review and disseminating findings back and see, hey, did we miss something? Are there things that we consider for the future? And so knowing all of these things, the last breakout room, next slide, we want to talk about, great, we've shared a lot of various factors that are at play that are potentially impacting clergy health. And we want to know, based on just as a group, and maybe we get into Q&A, what aspects of clergy mental health do you think are most pressing?
All right, so you have a few minutes out in your breakout rooms to discuss what aspects of clergy mental health do you think are the most pressing. Welcome back. We'll now have some time for Q&A, and I'd love to kick things off with a few questions that I've got, but I know that you probably have some thoughts or questions that have been going through your mind as well as you've heard everything. So feel free to either pop that in the chat or use the raise hand function, or just simply raise your hand, try to get our attention, and we'll be happy to turn to you. I'm so thankful that we've got both the academic side as well as the practitioner side of things here today. And I'll just begin with a comment that'll lead into a question, and that is that, I really wish that there was more that had been done up until this point on this really critical and important topic. The fact that you've identified 49 studies, I really wish that there were more. At the same time, however, there's a literature out there, like we have enough literature for there to be a review. And as I think about the different other kind of professions that are out there that likely do not have such robust literature there, I just think that's interesting. One of the things that stuck out to me was that there were 92 studies that were not included because they weren't in the US. And so I'm curious if you can just talk a little bit about the decision to focus on the US, and then maybe I'll just put in a little plug if there's anybody else doing some research, that could be a really interesting thing to think about, maybe even to compare the literature for the US perspective with what's happening globally. So yeah, any thoughts on the US focus?
I would say that's a great question. In our physical health scoping review we did, we included kind of a broader, and I think, going back to the original discussion of why that was back last year, I think some of it may have been the way mental health is defined or examined or looked at across across the world. That could have been why. And I think also it just helps reduce the scope of the work and maybe be more specifically to how do we effectively support clergy in the US, right? Our faith leaders in the US, right? To make it more practical. But I think you're right. And onto something of, if we broadened it, what would a global perspective look like? Travis, I don't know if you have any thoughts to share more of the practical side, but that would be from like an academic standpoint of the potential reasons.
Yeah, I think that pretty well covers it, frankly. Like you said, particularly different definitions of and what mental health looks like. But I'd also agree with that. It'd be fascinating to look at that and see those articles that were excluded because of that and see what we could learn. Like you said, make a comparison or see how that informs our results, how we might approach something from a practical standpoint that we hadn't thought of based on the 49-ish articles that we've come up with so far.
Yeah.
And I will say, just to add, I think that could be a limitation too. Because if you look back at our physical health scoping review, Buddhist priests were included as looking at vegetarian diet and obesity-related outcomes, and those were not based in the U.S. in that first study. And so if we had included that, we may have seen across religious traditions probably kind of looking at mental health. So that is a potential limitation of this study.
Yeah. Well, it's great to be able to think about specific populations and also the comparative elements. I don't know if you all saw, but just this week there was an article in The Economist magazine talking about the shift in the center of gravity within the Christian tradition to Asia. And I think that's something that we've known for a long, long time, that there is this kind of shift in the center of gravity that's happening. But anyway, thanks for that. And hopefully there will be someone that will pick up some of those articles, those 92, and to start identifying. And I'm sure that there are some within that 92 that for other reasons likely would have been excluded. But it strikes me that, I mean, let's just say, I mean, that half of them would be excluded for other reasons, that there's probably as much literature outside the US as there is inside the US. And so that's part of the reason why I suggest it. What are you all finding to be surprising as you're going through this this work? What is it that stood out that's just like, man, I did not see that one coming?
Well, I think Travis and I over the past month, as we've been doing these preliminary stages, I think, moving to the space of mental health, the amount of variables that are included to look at the connection between well-being, or however we define well-being, and mental health. As I mentioned at the end of the presentation, looking at the physical health space, it was like pretty direct, pretty pointed on certain things impacting obesity-related outcomes, for example. But we had to take a step back as we were reviewing and say, okay, what's the vision for this work? Because it could be so broad. And given, the person, as I mentioned, that like little diagram I had of just trying to pinpoint my thoughts of how do we capture all this, right? So you've got congregational expectations, personality dimensions, job demands, social support, spiritual well-being, subjective well-being. That to me was surprising. Travis, I don't know from a practical standpoint if you kind of were expecting that, but for me, maybe my lens was too public healthy, I guess, focused, maybe to not expect that. But anyway.
No, you're right. There's a stunning number of variables, and it was hard to get the mind around. I remember when Nate and I, when we were putting this together, he at one point said, "We got to talk about this," and said, "My mind is blown." So yeah, it really is pretty remarkable once you start getting into it. I guess for me at least, and I'm kind of surprised and not surprised at the same time. One piece that's kept coming up, which was the question of how can spiritual practice, personal spiritual practice, devotion time, Bible reading, prayer time, you get into Sabbath keeping, even though Sabbath keeping can also get into, I mean, there's a spiritual component of that, and also not a vacation component of it, but a time away component to it as well. But how various spiritual practices, as a pastor myself, I know I like to think that I am doing those pieces as well as I can. But it really made me think, am I doing those pieces? Because the spiritual practice seemed to be, I mean, a lot of the articles examined, are they protective around burnout or not? And which ones might be more protective and helpful in that regard. And I guess people in a church think, of course, my pastor is spiritual. Of course, my faith leader is tending to their own spiritual life. But maybe it stuck with me and really stood out with me because it seems so obvious. And yet, when I look at my own practice, even I see where there are some aspects that I do not tend to that I really wish I did. And over again, this seems to be coming up across the board that clergy are not and not doing that to the degree that would be beneficial to them and would just nurture their souls.
Yeah, I'll tell you one thing that stood out to me as surprising, Nate, was from your presentation where you talked about how that spirituality had not been like a robust kind of measure, because it seems to me that I don't know how you study this population without studying spirituality. It seems that those two kind of go hand in hand. And just for the benefit of everyone on the call, I'll mention that that Kate Long from Harvard, as well as Byron Johnson, have just recently released first wave findings from the Global Human Flourishing Study, where it's been like 200,000 people around the world, like 70 countries or something like that. And they specifically were looking at the role that religion and spirituality is playing in human flourishing, not specifically with pastors, but overall. So I'll point folks to that, and also just put a plug in that Kate and Byron are going to be coming to the Common Table Global Gathering in 2026, and they're going to present on some of those findings and kind of what are the implications for that, especially as they're trying to take some of the theoretical work and to put it into practice, actually in cities. So how do we like create flourishing congregations and communities at large? So it's going to be a great time, and I'll point you all to that. If anybody does have a question, feel free to pop it in the chat or to use the raise hand function. Otherwise, I'm going to keep on going. So I want you to talk just a little bit about the in one of the breakout rooms that I was part of. We talked a little bit about what comes to mind when we think about mental health. And I absolutely loved what Diane Owen was talking about. She says it doesn't necessarily mean that there's nothing negative that happens, but instead what she was trying to help our group think about was this idea of resiliency. And so maybe you can just speak a little bit about what do we mean when we talk about mental health? Is it like this sanctification, perfection, or is it something kind of more nuanced and granular? So as you've looked at these studies, how are they defining mental health in that context, and what's the role that resiliency plays?
Travis, you want to take that from a kind of what you've seen in the field, and I can kind of finish off with maybe kind of how we're defining it a little bit.
Yeah, so I like exactly that what you just said. Because as a person who, I mean, certainly it's not just clergy who know this. Not everything goes right all the time. In fact, things are often not going to plan. You're often having to step back and rethink and process through and things along those lines. And so, yeah, that is a way I think of it. Resilience, balance, would be another question or word that comes to my mind. How can I be in a place where when those things come, and they will come, I will be able to do what I need to do as a pastor, as a human being? How can I connect and relate and operate the way that I believe God intends for me to operate, and the way I want to operate, and how I understand my vocation, and that's responsible to the person or the situation that has come to my attention and has now been commended to me, and I have a role in it. That's how I kind of think of it. It's not being, maybe being in a place where I'm not ruled by whatever that thing is, and I can take a step back and say, what's going on here? How am I responding to it? How am I thinking about it? How am I feeling about it? And that informs how I perform within it, is in a way that honors the vocation and who I am in that vocation.
And I would say from kind of the literature, as we talked about, mental health is being examined, even other variables too, like satisfaction, like life satisfaction, subjective well-being. I'm looking at all the various factors: anxiety symptoms, mental health flourishing, depressive symptoms. So when you say mental health, I guess it's a good thing for us is what do we mean by that? And I think this paper could help us, or at least as we're writing it, define how we want to talk about that and what all the literature is saying. And I'm a big qualitative researcher, and so some of the qualitative studies that we looked at have, that's where my heart goes. And so I was looking at one before this, and a small sample of Lutheran pastors were, kind of coping with burnout. And the stories are really interesting to me, kind of reading through stories and experiences. And just the paper was talking about how, well, I'm feeling, pastors were saying, feeling burnt out, so I'll just work harder. So it's like, well, or pastors try to hide behind that, or, I try to do hobbies and certain things to kind of cope with burnout. But I thought the working harder piece, and it's, going back to what can we effectively do? We can't just say, well, you need to run more, or you need to work harder, or X, Y, Z. So how do we kind of go back to, well, one, how do we find mental health? What do we know about it, and how can we support? And I think all these conversations as what overall is being reviewed and examined, and how can we pinpoint things that are positively impacting that, and then maybe put those together in a study. So anyway.
Yeah. That's great. Well, and I want to acknowledge that we're at the hour, but there are a couple other questions that I've gotten. I know that maybe a few of you do too. Before anyone does head out, though, I want to just pop into the chat. There is a call for proposals for the Common Table Global Gathering, which will be held in January in Houston, Texas. We've already gotten a great collection of proposals thus far, but we do have a little bit more room. And so if either from the scholarly perspective, the academic perspective, or maybe you're a practitioner and you're doing something that's interesting or innovative or unique, or there's a problem you're trying to solve, feel free to take a look at this call for proposals. We would love for you to submit that. All right. So Glenn, I know that you had a question. Before you ask it, though, you have to tell us what time it is.
It's 6:30 here in New Zealand at the moment, so that's all good. If you guys could just adjust the time of these a little bit in future, that would be appreciated. So my question is, I agree that the majority of the literature seems to look at so many factors involved in clergy mental health, and it seems to focus on how they cope with the demands of pastoral ministry. I just wonder whether there's something fundamentally that needs to change about the role itself, that it's the role itself that's the issue, the modern expectations of the role. And I'm just wondering, did anything come through so far in your literature review and looking at the role itself and how it needs to change?
Well, I can start off with, there were some things looking at kind of differentiation of self from role identity. I haven't found much of the role itself. I mean, again, I point to Travis from a practical standpoint, right? I don't know if you have anything to add to that. I haven't seen anything from the role itself. That might be really interesting. And before, I will say the paper I just talked about, Pastors Coping with Burnout, highlighted how, again, we know this, but it's a call, right? People feel called to ministry. And so if it's with the role itself, how do you navigate that? Anyway, I'll stop there.
Yeah, no, I mean, I'm like Nate, I don't recall just a whole bunch about that. And I believe that's a really important question. Um, I believe, I've wondered about the role itself, and I've wondered too about models of church, frankly, and how, I mean, and those two things are linked very carefully. How do I serve as a pastor, but also what kind of structure am I serving within, and how does the structure mold the role? Was a question for me back when I was thinking about adding that into the dissertation. Of course, it got too big and that got put off to the side. But what those two things go hand in hand. I think that's a great question. Yeah, the role itself and the expectations of the role. Very powerful.
Yeah, and one of the breakout rooms I was part of, we talked a little bit about just the importance of having like a job description and how establishing kind of boundaries and expectations can be really important for pastor to live up to, whatever it is that the oftentimes unstated expectations, and then to be able to kind of formalize those in a practical way. Another person in one of the breakout rooms that I was part of brought up this concept that, and this gets back to kind of what I was talking about in terms of like, is it resiliency? Is it, like, how are we thinking about or defining? But they talked about how for pastors, so much of their life is tied up in the idea of calling. And so for many, maybe not all, maybe some, I don't know, but for a select population, when they do struggle, it becomes a kind of almost an issue of moral failing. And then when that is combined with a lack of vulnerability or an unsafe environment in which you feel that you can actually share those feelings or ask for help, like it kind of snowballs in some really unhealthy ways. So I'd be curious, Travis, from like just the practical side of things, like where have you seen that vulnerability kind of show up in your work, or where have you seen this idea of kind of the moral and ethical failings if I admit that I have a problem? Help us to understand some of that.
That's a great question, because certainly those pieces come in. I know from my own experience. And then the moral failing, yeah, how have I failed, and what have I done not to meet those expectations and things? Those are powerful ones. I have learned that I have to think about call in a couple different ways. One is, yes, there was a macro call in my life towards ministry that I did not feel like there was anything else I could do ultimately that would be meaningful to me in the same way. But there's also the idea of kind of the micro call, the call in process. My sense of call, the sense of call with a capital C has been very much a that kind of what got me started. And then there's a sense of call as process or micro call, where I am evaluating what that means all the time. Called to what, called to how, uh, called to where. That flexibility of call has been very helpful to me. And it's helped me particularly in the context of vulnerability. Because a lot of times pastors do not feel like they can be vulnerable. I remember, in fact, one time I was working with a seminarian, and I asked them what their idea of a role of pastor was, and they said to be perfect. And we worked through that over a while of, a period of time, about what does that mean, and came to the conclusion, and I think that that person also came to the conclusion, that a perfect pastor, in fact, would not be of much use to anybody, because that's not a real helpful model, to
Mm.
be perfect in the sense of without flaw.
Mhm.
Because life is full of instances that are going to bring out those flaws and those vulnerabilities, and how we handle those is of utmost importance, and how we model how we handle those. I mean, I have learned, and I probably started that way a little bit I mean, I have to be a certain way, but I've come to where embracing that vulnerability as part of that flexibility of call and how I define call now has become very important to me, because and I believe that's actually where clinical pastoral education, being a chaplain, helped me a lot.
Mhm.
Was how do I understand myself in context, and how I'm reacting to this, and that's okay that that's how I'm reacting to, and I can even give voice to that in many circumstances, and that will help me to connect with that person in that circumstance even better. Um, Still requires some judgment, but that has been part of my call-in process that I've thought a lot about, is that vulnerability piece.
That's great. Let's give the last question to or comment to my dear friend Melinda.
Thank you. Um, I just wanted to say one of the things that I raised in the group. You had to ask a question, and one of the things for me is that there are quite a few unspoken, unrealistic, and dangerous expectations that people in the church have for what pastors are supposed to be able to do. And I think pastors, of course, are weighed down by that. And particularly because it's unspoken, you see. But we're all supposed to know those things. And if you try to change that, people will then challenge you in ways that make you feel guilty. If they don't make you, but you will most likely feel guilty and so forth. So the thing I want to say is that it's important for us to begin to name what those things are, to
Mm.
put it out there. And I think if you're in a position as a pastor, you have to preach that. You have to
Mm.
preach that pastors cannot be everywhere and do everything, that there are others who have gifts in the church. You have to preach uh, the gifts of the body of Christ. It's not just one person there. It's all of our gifts that come together, and there have to be. I think if we're going to help pastors with that particular thing, there has to be some group like those of us here and those who have spoken, who can create ways to
Mhm.
begin to deal with that, because I feel like we really don't deal with it. And I've talked with too many pastors who, are overwhelmed and decide they're doing terrible jobs and they need to just leave. And you've looked at the literature a lot. Often that's what causes pastors to leave, because they feel like they're not doing a good job. and so forth. So I think that's a critical piece for us to begin to look at.
Absolutely. Yeah. Well, thank you so much for that wonderful and stirring comment, Linda. And Nate and Travis, thank you so much for your work thus far. We look forward to seeing as you get closer to publication, and would love, as you are able to share maybe a bibliography of those resources, we can post those on the website when the time is right. And that way, if folks want to go kind of dive deep on a particular topic, that'll save them some time and effort. Again, thank you all so much for being with us today. And I'll just, again, pop into the chat about the call for proposals. We're going to be on summer break for the next few months, but come fall, we will reconvene. And we've got some great things already planned on youth mental health. It's a really important topic, especially for how faith leaders are helping young people. We've got one on governance as well that's going to be coming up. So it's going to be fantastic. You can check your emails and all. But in the meantime, please do submit a proposal. We'd love to highlight your work, and we're so grateful for everything that you all do. Hope you have a wonderful summer.
Thank you so much, Thad. Really appreciate it.
Thank you all.
Thank you all for coming. Take care.